You gotta love summertime, don't you? But then you gotta remember sunburns, rashes, bee stings all come with it, all those unexpected ailments. So how do you treat them? Well, joining us to talk more about that is Dr. John Griffin with Kelsey-Seybold Clinic. Welcome to Houston's Morning Show.
Thank you. Good morning, Melissa. Thanks for having me.
Well, it's kind of hard to even fathom a sunburn right now. It's been so gray over Houston for so long, but let's talk about that because people are traveling all over the place where there is sun. There are different types of sunburns, aren't there?
Yes, ma'am. And that's a great point you make. You know, even when it's cloudy outside, you can still get enough of the ultraviolet rays to cause a sunburn. And it is, there are different types. You know, it really just depends on how much sun you get. There's the sunburn we're all familiar with where you just turn a little bit red and it's a little tender. But if you're out longer than that, you can get blisters, something we call a partial thickness burn.
And I think we just need to remember, no matter what, like you said, on those cloudy days, that sunscreen is the key to preventing it. And,
Right.
and I think one of the biggest mistakes people make is maybe not putting on enough and often enough, right?
That's exactly right. Yep. And the SPF does make a difference. You know, we say at least SPF 30, but more than that probably is better. And I agree with you wholeheartedly. You have to reapply after about 2 hours, so it doesn't stay on there forever. And you're really supposed to use about an entire shot glass full to cover your whole body. So way more than most people would typically use.
That is a lot of sunscreen. Now, what is the best way to treat a sunburn if you forgot to put on that sunscreen or didn't put enough on?
So unfortunately, there's nothing that makes the burn go away quicker. Now that would be the best solution, but it's really just managing the symptoms. So that aloe vera gel may feel nice on your skin. If you're really feeling bad, some just ibuprofen may make you feel a little bit better. And then you just have to wait.
Got to be patient. And then comes the peeling. Oh, that's a fun one. All right, let's talk about something else because the skin rashes are really, unfortunately, prevalent this time of year. How can you tell the difference, or maybe if it's an allergic reaction? Sometimes it can be confusing if you don't know.
Yeah, absolutely. Well, we see all sorts of different skin rashes this type of year, and the ones that that really pique my interest are the allergic ones, and they can be curious because most skin allergies are to something that physically touches your skin. So they tend to have kind of a shape to it. You know, it's like I put this this cream on my face on this side, and only this side has the rash. So those are some of the clues. We call it an outside job.
And then I'm seeing some different things that you can do. Best way to prevent or treat that?
Yes. You know, some over-the-counter hydrocortisone can do a great job for the simple skin rashes. And it's really the ones that they just keep on coming back, or they're so severe that you're having symptoms that are really making it uncomfortable to work or to function around the house, that I'd recommend seeing a physician for.
And the last one I wanted to ask you about is bee stings. I recently went through this and posted about it, and everybody had every kind of cure in the world, and it took a long time to get over that pain. How do you tell if it's a bee sting if you don't see the bee, and then what's the best way to treat it?
Yeah, great question. Well, it can be tough. If you don't see the bee, the classic signs are redness, swelling, and pain. And if it happens just instantaneously, that's a good clue that it was either a bee or something related to that. And then as far as treatment for those, same thing, time plays a big role, but you can use ice. If it's, for example, on your hand, you can elevate your hand above your heart. That'll help with the swelling to go down. And then, if you start having any serious symptoms of an allergic reaction, so shortness of breath, if your lips or tongue are swelling, then you need to go to urgent care right away.
All right, good information to know. Dr. Griffin, thank you for your time this morning. It's really good to talk to you, and hopefully this will help people if they deal with any of these things. Good to talk to you from Kelsey-Seybold.
Thanks, Melissa. Have a great day.
You do the same.